Thank you very much, and thank you for your patience. I'm sorry we've slightly overrun, but I think you can understand why that evidence was incredibly powerful and informative for the committee, so thank you. Welcome to everybody for panel 2, and a massive welcome to Ashton Collins, Director for Save Face, Professor Vivian Lees, Consultant Plastic Surgeon and Vice President of the Royal College of Surgeons, and Sasha Dean, who has lived experience of severe complications following a liquid Brazilian butt lift. BBL is what we will use from now on as the term. Thank you all for being here and welcome. I'm going to hand over to Christine now.
Thank you, and thank you all for joining us. Professor Lees, I wonder if we could start with you and whether, I think we're particularly interested after what we've just heard, does the Royal College of Surgeons have any view on the safety of breast implants, particularly in light of the emerging evidence of the potential effects on women's health and what we've all heard today?
We are obviously open as practicing clinical scientists to new evidence which does emerge. So the position we take obviously depends on the evidence available at the time. So it's obviously concerning to hear some of the things which have been presented in the last session. There are very important benefits for breast implants, though. You've mentioned yourself breast reconstruction, and the psychological benefits for women who are particularly self-conscious about their shape are undoubted. So we don't want to deprive people unnecessarily of their implant, but we do have to make sure that they're safe, first of all. So we don't have a formal position on that, but we will be very mindful of evidence which comes forward.
Are there any plans to examine whether you need to make a formal decision or any inquiry underway?
We have the National Breast Implant Registry database, which started in 2016. All implants are logged onto that by responsible practitioners, and that includes the type of implant. So we do understand which is the manufacturer, they have serial and lot numbers, and the reason for putting them in has to be recorded. Obviously, the PIP implants were not put onto that database, but they are being captured as they come out again. So if an implant is removed, that's also recorded. New implants may or may not be put in. So there is some narrative around why that implant was used and why a subsequent set has had to come out. So we are gaining that information. I think it's absolutely right to flag the fact that we mustn't lose this database with what's happening to changes in NHS England. It must be migrated.
I'm sorry to pressure on that, but I mean, will this database be used to come to a view or a recommendation of any sort on the safety of breast implants?
The point of the database is to flag concerns, but I would probably agree that we're not capturing enough data about possible symptoms on it at the time of removal. So at the moment it's not set up to do a biannual review and record that. It's not. But equally, symptoms are not captured at the time of removal. It would capture, however, things like capsule contracture, whether the implant has ruptured or not, and any other concerning features at the operation itself.
Thank you. Ashton, I wonder if I could ask you, in recent years the number of cosmetic procedures has been steadily rising. What do you think is driving this?
I think there are two primary factors. Without doubt, the biggest proponent has been social media. I think if you look at, especially with non-surgical treatments, when they first came to the UK circa 20 years ago, they were very much the reserve of the rich and the famous, and nobody wanted to discuss having them done. Whereas with the advent of social media and reality TV, more and more people are happy to discuss the work that they've had, and in turn promote that work on social media. And I guess especially for younger people, that is where they look to get information, but also to find practitioners. And so it is a constant source of not only misinformation about how safe these treatments are, and they're not informing end users about the risks, and it is also a hotbed for unscrupulous practitioners to prey and target women into believing that they need these types of procedures as well.
And is the rise uniform across the board, or is it most notable in sort of certain demographics? And why do you think, if it is, why do you think that is?
I think it's the surge has definitely been more geared towards younger people, and so we've been established for 10 years, and in that time we've gathered patient-reported data on complaints and concerns, and we've helped over 15,000 members of the public either with unwanted outcomes or adverse reactions and complications, and over 50% of those have been from women aged 18 to 30.
Thank you. Sasha, I wonder if I could ask you those two questions as well. First of all, what you think is driving this increase, if you would agree with Ashton.
Yeah, I agree. It's definitely social media. For me, it was something that for my liquid BBL, it was something that I hated on my body for a long, long time. And so, yeah, when it started coming through, I thought that was definitely going to be the easy option for me, and seeing so many women have it done and it being deemed as safe, that's what spurred me on to do it rather than the surgical route. So, but yeah, anything but safe.
It's interesting you say that. Do you think, you obviously believed it was safe?
I was told it was safe.
You were told it was safe. So would you say that perhaps that lack of awareness that we've heard about earlier, that needs to be addressed, and addressed quickly?
Yes, because they all know, the people that are carrying it out, that it is not safe. The clinic and the practitioner that did me knows it's not safe, and their social media is still saying it's safe. And they know that they nearly killed me.
Yeah.
Thank you, Christine. Shivani.
Thank you, Chair. I'd like to just kind of discuss a little bit specifically on the liquid BBLs and boob jobs. So, Professor Lees, if I can come to you first. As we know, liquid BBLs and liquid boob jobs have gained popularity in recent years. What specific risks are associated with these procedures?
I perhaps better explain that there's two versions of enhancement of large volume areas like the buttocks, and it is typically the buttocks because implants are used for the breast area, but it can be both. So surgically, we tend to use fat graft, which is from that person's own body, taken from one place and then re-injected into the target area. And then what's called liquid BBL is an off-the-shelf filler. For example, Restylane, but it can include silicone, free silicone. And from what you've just heard, you'll understand the implications of that. So a number of filler materials typically being injected under a local anaesthetic rather than under a general anaesthetic in a hospital. So one of the big issues is the environment that this is being done in, which may not be a sterile environment, may not be clinical, may just be on the high street. And that's very concerning. And the other clearly is informed consent about the risks that somebody's running. And if you do inject any of these materials, be it fat or filler injection, and you hit one of the large veins in the gluteal muscle, that can result in the material travelling around into the lung and causing a pulmonary embolus. That can be fatal.
And thank you. And just so I'm clear, so that the non-sterile environments that could lead to infections, and is that correct?
Yes, it's a very serious matter for any of these procedures or indeed other surgical procedures to be performed in a non-clinical environment. So the confusion of the term beauty clinic makes it sound like a clinic, but it's not. What we're talking about is a medical clinic which comes under the regulation of the CQC and the medical practitioner under the GMC, versus the High Street Clinic, which is under the Environmental Health Authority, and they're not clinical specialists.
Thank you. And then, Ashna, and I know you just discussed this, but were you aware of specific risks associated with these kind of procedures?
Me?
No, Ashton,
Oh,
sorry.
Ashton.
Oh, but and you, Sasha, I'd like to hear if...
So from us as an organisation, we became aware really of how severe the risks with these liquid BBLs were in 2023, and we launched a campaign at the end of 2023 calling for the government to restrict the administration to plastic surgeons only in CQC regulated settings. We've helped over 700 women who have fallen foul to these types of practices and ended up in hospital with sepsis and needed corrective surgery, and I cannot stress strongly enough the impact that these procedures have on both their physical and their emotional well-being.
Yeah, and Sasha, you were not informed of any of the risks before you went for...
No, none whatsoever.
Yeah. And if I can just come back to you, Professor Lee, so can liquid breast augmentations make it more difficult to accurately screen for breast cancer?
It's not commonly done. Generally, our surgical community would offer breast implants, but we do also use autologous fat, maybe a combination of the two techniques together. And when that was first described, there were concerns that the fat graft might cause some confusion because it got a little bit lumpy and might be mistaken for a breast cancer lump. But those concerns, if you will, haven't perhaps borne out in practice. So people are more comfortable with doing that surgically now. But if we're talking about filler materials, then that could certainly confuse diagnosis.
Yeah.
And that is a safety issue, clearly.
And how do those risks compare with a surgical BBL or versus or a breast augmentation?
So the comparison of
Liquid
surgical versus a liquid butt lift, there's not really good data on this, and it's one of the problems we have in the whole area, that we don't have really good data because practitioners, non-surgical practitioners are not recording outcomes. We are calling really for government to make an amendment to the Health and Social Care Act of 22 to restrict the practice of cosmetic surgery to surgeons who are board certified in cosmetic surgery. The board certification is something that's been supported by the 4 Royal Colleges, including that of Ireland and of the relevant surgical specialty associations. So a lot of time and effort has gone into building this programme, which demonstrates for those who hold the boards that they have a real commitment to safety. They've reached the training requirements. They've got experience in dealing with this. They've undertaken professional masterclass in communication skills with patients. They reflect on their activity, they audit their activity, they do an annual appraisal including a whole practice element, so if they practice cosmetics that's included and is part of revalidation. And that's really to say there are people there that the public could access and hopefully have a good experience.
Thank you, Chair.
Thank you, Shivani. Sasha, thank you so much again for being here. Could you tell us a bit about your experience of getting a liquid Brazilian butt lift, please?
My journey started many years ago with an asymmetry on my body. It was never to do with, wanting a big Kim Kardashian bum or anything. I had a very, very flat glute muscle on one side compared to the other side. So I started off on my exercise journey. Didn't work. I then did look into the cosmetic journey, to the surgery journey, but that didn't work for me. I had to gain some weight. I went to have some the fat taken out of my body, and then when it was went to be transferred into me, I wasn't well. So the surgeon said it's not safe to continue on. So had the fat taken out, but I couldn't have it transferred. So went back to my exercise journey to try and correct this asymmetry, and it was a big deal for me. So I'm tall. I find it hard to get clothes. After I'd had my children, I kind of gained a bit more weight around the middle, and so I was very narrow on my hips and very flat on one side, and it became even more challenging to get clothes for me. So when the gym wasn't working, and then this liquid BBL was coming through, the clinic that I was going to for my anti-aging bits and bobs, they said there's this new filler coming out, it's really safe, it's hyaluronic, it's, you know, what you have in your lips, and you've had your lips done before, so, you know, you're going to have no reaction. And I was like, wow, you know, this is fantastic. So I entered on my journey with them. They asked me if I could be their model, which I did, and I had it done, and it was actually okay the first time. It's excruciating pain, but I was okay. I was just pleased that there was something that could. And they said you'd probably only need a couple of 100 ml. You need to do the other side as well as that side to get it looking the same. So, you know, a couple of 100 ml, you'll be good. No, it was very apparent that it was then going to have to be an ongoing situation, because you could see where the filler was sitting. So I had it done a second time, and we thought that was going to be good. Again, the pain was excruciating. I didn't actually know if I could then embark on it a third time. I did, and the third time there was problems. I don't know whether it was just the volume of filler that was, you know, there was a sort of 200 ml in that side now. I started to get an infection. I ran the clinic. They said, just take some antibiotics. As blasé as that, just take some antibiotics. I did actually have some antibiotics at home, but by this time I was oozing all down the leg, and I thought, oh, this isn't good. Anyway, the antibiotics cleared it all up, and it was, you know, it was okay. A few months on, it started going a bit of a weird shape. And so I actually spoke to the senior, but she was their nurse, effectively. It transpired she wasn't a nurse at all. She was just anybody that can carry this out. She said to me, look, I reckon we just need to do another couple of 100 mils. You're going to be done. You're going to be fine. And I said, I can't afford this anymore. It's so expensive. And I'd been their model and stuff before, so I didn't have to pay the... So she said, come to my house. I have a clinic at my house, and we'll do it there, which I did. In itself, it, you know, first glance, it looked okay. It was sterile enough until I was laying down, and I'd halfway through, and my partner, who was in the room, noticed the state of my feet, and he said, to really like your feet until I saw the state of them. And I kind of looked back at my feet, and they were black. To which she turned round, her mum had come in and was sitting in the end of the room as well, and had a go at her mum for not sweeping the floor when she'd done her client's hair.
Oh my God.
So that was that.
Okay.
So I remember thinking, okay, this isn't good, but it's too late now, let's finish. I'd say immediately we finished that, it's just getting out of there. It was cold anyway, it was like the 30th of December. My temperature just dropped out. I remember getting home and it was 35 something. I could not warm myself up, couldn't have a bath because you can't get it wet. And I said to my partner, I'm going to go to bed. Unbeknown to me, the sepsis was creeping in. So I kind of lost all sense of reality for the next couple of days until... yeah, the ambulance was called on the 2nd, and I was in full-blown septic shock. And yeah, that's where my kind of journey began.
My goodness. Thank you for sharing that, Sasha, and I'm sorry you've had that ordeal. Obviously there was the immediate sepsis. Was there any long-term health complications following this? Yeah,
so obviously I was admitted into hospital. I was transferred immediately into ITU. My family were told there's no chance of 5%. I was then, in ITU. A few days later, it was apparent I was struggling to breathe. So I was put into a coma for 5 days. They just, whatever they were doing, it wasn't working. I had a heart attack. My kidneys failed. My lungs collapsed. It was pretty much just hopeless. I don't actually remember anything pre-coma, from being in A&E to ITU to the coma, but I remember being in the coma. I remember my partner trying to do a rose in my, what was long hair then. My daughter, obviously, telling me to fight, my dad telling me to fight, and I remember trying to signal to say, I'm fighting, I can hear you. And I did, obviously, I made it. So 5 days later, they woke me up out of the coma, and it was the most traumatic time, that the terrors I had. Ian Huntley standing in my wardrobe trying to get me to go in there, and just all these nightmare things happening to me. But I was in hospital for the next 5 weeks, just getting better. They couldn't really get the infection under control. They were trying everything, but eventually, after about 4 weeks, they said, you can go home. I went home with my lines in and went home to recover, where I had to learn to walk again, because obviously laying flat for 5 weeks. And so, I'm left with, I've had an MRI of my brain, because walking and talking at the same time is challenging. I've got weakness on my right hand side. I drop things with my right hand, and whilst I've got no brain damage, they felt that I've got small vessel damage, which will just be enough to keep me, displaying sort of weird symptoms. I've got ongoing kidney issues, which I've got to have checked out. My lungs keep having to be checked. My heart, I've left with a leaking heart valve. I struggled with my business and me and my partner's business, so all last year I couldn't really work, so the business was in real jeopardy. It was only because partner and family stepped up to try and help to, I have a mortgage, I had my children, I had to look after, and I've completely, the last year, have been unable really to do anything. Then I lost all my hair. It's a profound, the impact, and what's made it even worse is there's a grey area with all of my issues. So whilst I had a heart attack, because they treated me so quickly, I thankfully don't have any muscle damage. So my critical illness will not pay out for my leaking heart valve, because they don't cover it. So there is no recourse for everything that I've been through, and not being able to pay my mortgage and stuff, they won't pay out. And because the clinic, there's nowhere to go with them. You can't sue them, because even though my solicitor, he got a court order sorted that was handed to the clinic and to the girl that did me, they won't pass their insurance to it. Even though there's a court order, they're just saying no. And they don't have to provide that. So there's absolutely nowhere for me to go with this. There's no recompense. That's just it.
Is this clinic still up and functioning?
Yeah.
It is.
The clinic are saying that it's not their fault, because I chose to leave that setting and go to the girl's house. But we know, Ashton knows, that yes, whilst my setting was not sterile and not ideal, there are many clinics that are sterile and are ideal. I saw on that Olivia Atwood case with the gentleman that was going on about how sterile it was, and he was using the top of the art laces, and the girls still get sepsis. And what concerns me is poor Alice that died last year. I mean, I don't know the circumstances around her, whether she had a blockage or, whether the other girls, they have blockages. Or I didn't have a blockage. I just got sepsis. Some girls got blockages. Some girls got sepsis. Some girls, Is it the filler? Is it the area? Is it the lidocaine? We don't know what's causing all of these issues. And
I mean,
it's crazy.
You said just sepsis kills.
Yeah.
Yes.
So
Yeah.
I think what you've described is horrific, but clearly you're not the only person that has experienced this. Sasha, what would you say to somebody that was considering cosmetic surgery now, of any kind?
It's hard for me because I understand why women do it. I understand, not even the peer pressure, I worry about the young girls. I was saying to Ashton just before, I'm so thankful now. Obviously, I never wanted my daughter to witness what she witnessed. But I am so thankful that she is not going to go on that journey. And so I understand why women do. I can't sit here and say, don't do it, because, so many women are doing it. But at least do your research. And with this BBL, these are being carried out by anybody. They don't need any qualifications. And the irony is, my daughter, the day that I was taken into hospital, went to the very clinic whose girl did this to me and was training to be an aesthetic, carry out Botox and lips. And obviously she paid a lot of money for that course, and she won't touch it, she won't go near it. And so
there is a real imbalance here, that if somebody had beaten you up and caused the amount of damage that this woman had done to you, in any other setting, they would be behind bars. Ashton, what measures are in place to track and report adverse events related to non-surgical cosmetic procedures? None.
No. So the MHRA operate a yellow card reporting system for dermal fillers, but again, it's at the discretion of the practitioners, and many of the people that are carrying out these liquid BBLs are unscrupulous. They're advertising them as being risk-free, pain-free, no downtime. All of that is complete lies. And Sasha's story isn't isolated. We have dealt with over 700 women, many of whom have been in very similar situations to Sasha, nearly lost their lives. Their loved ones have been called in to say goodbye. They might not make it through the night. Some of them have been told they might wake up without their legs because the abscesses and the sepsis has gotten so severe. We've had one death related to these procedures, and these are surgical procedures that should not be being carried out on the high street. They are being carried out in people's living rooms, in Airbnbs, in hotel rooms, by people who are using products that they're buying unlicensed from places like China and Korea. They are decanting them from huge vats into individual syringes and injecting thousands of millilitres into people's breasts and buttocks. And then when things go wrong, they are misdiagnosing these problems and telling them there's nothing to worry about. And luckily, all of these women have taken themselves off to hospital, because if they hadn't, there would have been countless deaths in the UK because of this, and it shouldn't be allowed to happen.
Thank you, Ashton. One of the other inquiries that we have at the moment is female entrepreneurs. We know that the beauty industry is one where female entrepreneurs are growing, and it is fantastic to see. What is the sense amongst the kind of cosmetic industry about your campaigns to see the tighter regulations on this?
The vast majority of practitioners are 100% behind the fact that these procedures should be limited, because they are surgical. They should only be carried out by surgeons. And anybody that doesn't agree with that is not a scrupulous practitioner that has their patient's best interests at mind. These treatments, even in the safest surgical hands, still pose significant risk. And so if you are a lay person with no medical background offering these incredibly dangerous procedures, you shouldn't be operating.
Thank you, Ashton. Rosie.
Thank you, Chair. Gosh, that was pretty shocking. Thanks so much for being so honest with us. I think people at home watching will be really moved by your story. Professor Lees, we're going back to just talking about education and informed consent, if that's okay. Are patients adequately informed about the risks of implants or wider cosmetic surgery, in your opinion? And are cases like Sasha's common enough for that to be factored in, do you think?
Well, Sasha was not treated by a surgeon, just to say that. Yeah. So from the point of view of the surgical community, what we would recognise as best practice consent would be obviously a clinical assessment of the need for a procedure, be that physical or with psychological element, providing information both through stage discussions, through written generic information, and then personalised letter to the patient as to the facts, the pros and cons, and trying to work with the patient as a partner to reach the right decision for them. We recommend 2 consultations with a cooling off period, 2 weeks apart minimum, so people don't consult with a non-doctor, meet the doctor 5 minutes before the operation and then go straight into surgery and then regret it, because we want people to be suitably supported and happy with the procedure and have successful outcomes. That's what we want. So clearly informed consent is key. Is it what always takes place? We have no idea. But we obviously, as responsible end of the practice, will be auditing our results. We can look at outcomes, satisfaction surveys, and these things are all doable, of course.
Thank you. So is there a problem with regulation? Because obviously you're one end of the scale, and then we've got these people doing it in their houses. That it seems like anyone can do anything, and, you know, in a way your reputation might be damaged by this, and the other way around, people are going to assume the same standards are going to be carried out at that end of the market.
Yes, I think that's absolutely right. And one of the problems is because we have such a degree of regulation in this society around all sorts of things, the public thinks that all of this is regulated when it isn't actually. So we really are asking, if we may, Chair, through yourself, for the consultation which took place in 2023 around the regulation of non-surgical procedures, just to ask the question of the Secretary of State when that might be published and we get to learn of his determinations around that. I think that would be really helpful, because clearly there's no regulation around who can do what, and we have non-doctors doing operations, as you've just attested to, and misrepresenting themselves to the public, which is a really difficult dynamic and something that we'd like to see ended.
Thank you. And do you think there's adequate informed consent given before procedures like Botox and what we sort of everyday kind of procedures?
No, and just drawing back on the data that we've gathered over the last 10 years, over 90% of the people that we engage with that have had procedures gone wrong or unwanted outcomes haven't been appropriately consented or consulted before having the treatment. They're not explained what the risks are, how that practitioner would mitigate those risks should they occur. And what we do see is that when these unexpected things do happen, the lines of communication are closed down completely. They're often blocked and ignored and left to fend for themselves. So the consultation and consent process is something that is incredibly important but is incredibly lacking, and especially amongst the younger age group, like I mentioned before. They are, these procedures are incredibly trivialized amongst that age group. They see them as an extension of their beauty regime, like getting your hair done or your nails done. They don't have any medical association at all, and so they are so vulnerable to be exploited into thinking that this is a transactional type treatment. So we see scenarios where they're just sat in a waiting room with numbing cream on. They brought in one by one, they have the treatment, they pay their money, and off they go. And so it is a very real problem, and even more so when you consider higher risk treatments that are really surgical, like the liquid BBLs and the breast augmentations, because they are being missold on an enormous scale.
Thank you. How else can we better educate people? Obviously you're doing your bit and people who've survived are doing their bit, but what role might Parliament play?
think education would be key, you know, even where legislation exists. So, for example, Botox is a prescription-only product, but in 96% of the Botox complaints that we deal with, people don't realise it's a prescription-only product and therefore have no expectation that they ought to be seen by a medical prescriber before having the treatment. And so I think even where rules and regulations do exist, without that public education to empower them to make a safer choices, you know, no rules are going to be, you know, robustly enforced, because the public need to be aware that they exist in the first place.
Wow, so when people go and get a bit of Botox, let's say a dental practitioner or something, that's not actually supposed to happen because it's supposed to be prescribed.
So
I know people here that have that done.
Yeah, so exactly that. So anybody can inject Botox, so your beauty therapist, any sort of layperson. There are no rules around who can and can't inject it. But because it's a prescription-only product, every patient should be seen in person by either a doctor, a dentist, a nurse prescriber, or a prescribing pharmacist. And that is something that is grossly under-enforced at the minute and under-policed. You know, and what we're seeing a huge increase in as well is that people are now circumventing that prescription element altogether and are buying unlicensed products and illegally importing them from places like China and Korea, with devastating consequences as well. So I think if the government were to tighten up on those two pieces of legislation, both of which are in place at the minute, and they were properly policed and properly enforced, it is estimated based on our data that around 80% of the complaints that we've dealt with, it wouldn't have happened in the first place. And they would have been appropriately dealt with and managed if that system was more robust.
Oh, thank you. Finally, Sasha, thank you for being so brave again. Do you feel that you had enough informed consent from the beginning of your, 2 or 3 procedures? Or would it have changed your mind if you'd had more information, do you think?
Absolutely would have changed my mind if I had more information. But like as Ashton was saying, it's so played down. It is literally like, oh, well, you've had it in your lips. It's like no different. It's not painful. Yeah. And you're literally sitting in the same waiting room, just literally with the women in and out, even just going and having it done. You're in the same room, same environment, and you just think. But I think that's what lulled me into the sense of security. It wasn't going to hurt as well. I kind of just thought, oh, because it is just in that room where I've had my lips done, it's just going to be a little bit. But it really is a surgical procedure. So I was, misinformed to start with, and obviously I took the decision to do it again because I was on that journey. It was too late. I had to keep going. So, but interestingly, I signed a consent form that was the same as you saying about the consent. The consent form was actually the same as having my lips done. And when I went to the other girl's house, she didn't get me to sign at all. There was no consent at all for it. So,
thank you very much. Thanks, Chair.
Okay, thank you. There's consent and then there's informed consent. Yeah. There are two different things.
Yeah.
Kirith, and then Catherine has a supplementary as well.
Thanks, Chair. Ashton, you and I met last year, I think, to hear about, you told me about a constituent. For the purpose of the committee, I'll just tell her story a little bit. So Louise's mother experienced significant trauma following a botched liquid BBL procedure at a non-surgical clinic. She travelled from Bolton to Chelmsford in Essex for the procedure. She had been assured that the procedure would be carried out by a qualified professional with whom she had previously communicated. However, upon arrival, the treatment was instead administered by a man she had never met, later revealed to have not completed medical training. She'd already paid a non-refundable deposit of £435, so she felt pressured into proceeding. The procedure itself was rushed, deeply unprofessional. The practitioner walked in on her whilst she was undressing. He took photos of her buttocks without consent, acted aggressively during the treatment, and used the same needle on both sides, posing a serious infection risk. Within days, Louise developed sepsis and was rushed to hospital for emergency surgery to remove a life-threatening abscess. She sought this treatment in good faith, believing it to be safe and professionally conducted. Almost a year later, she's still not fully recovered, has lost her previous job, and is experiencing significant mental health challenges. Ashton, do you think if Louise had been properly informed about the risks and how the procedure was going to be carried out, where it was going to be carried out, do you think she still would have gone ahead with the procedure?
Definitely not. None of the women that I've spoken to would have gone ahead if they'd known the risks. I mean, you know, it never occurred to me in my wildest dreams that when I started Save Face 10 years ago that I would be one day sat in front of a family who's lost a loved one because of one of these procedures, and nobody, if they were told that you could potentially lose your life, you could end up in hospital with sepsis through one of these treatments, that you would go ahead. You absolutely wouldn't. These women have all been misled into thinking that these are risk-free beauty treatments when the exact opposite is true.
Thank you. Thank you very much. Thank you, Chair.
Thank you, Kira. Catherine.
Yeah, my question is around public, kind of leading on with the public education side of things, and how, I mean, we're talking a lot about informed consent and consent, and how, if the government was to do a national kind of communications campaign saying to women, you know, these procedures aren't safe, don't have breast implants and don't have cosmetic and don't have liquid fillers, how might that impact though those people who've already had it done? What would, you know, I'm just thinking about the psychological impacts, or whether you think we should just really take the bull by the horns and do a big campaign so women do know the dangers.
Right. I think, you know, in terms of telling people they shouldn't have any sort of cosmetic procedure, I don't think is the right way to go. I think that might drive people underground into rogue practitioners. I think the vast majority of treatments, depending on patient selection, informed consent, can be safe in safe hands, where the benefits outweigh the risks. It's about educating people how to make informed decisions, how to avoid rogue practitioners, and really helping them to understand what their treatment options are and how to go about finding a safe practitioner.
Would either of the others like to comment on that? Oh, that's fine. Thank you, Chair.
Thank you. Catherine, we're moving on to section F, the regulation.
Oh, and it is me. So
apologies.
Here we go. So, are the current... this is for you, Vivian. Please. Are the current regulations regarding cosmetic surgery sufficient? And if not, what changes would you like to see?
We don't think that the current regulations are sufficient, in brief answer. Sir Bruce Keogh's review from 2012 was quite clear in seeking to address what regulation we needed, both in non-surgical and surgical interventions. And quite a part of that has not been enacted or finally adopted by government, and we would like to see it. There is value in thinking of it as both happening together. We think it'd be really helpful if the surgical side could be regulated along with non-surgical, because out there we've got practitioners who think they are surgeons, who are doing procedures. So perhaps the very high-risk interventions are kind of falling in the middle. So it would be helpful to regulate all at once. From the surgery side, we've got the board's certification ready to go, and we have a lot of people signed up to that. A lot of people are busy getting signed up to it, so it is a solution if it's wanted. So the Keogh review wanted the right practitioner and proper providers, by which I mean the hospitals and the actual clinics working together. He asked for high quality care with prostheses and other injectables. Injectables are classified as devices to make sure that they're properly sourced and safe to use. So that was partly addressed through the National Breast Implant Registry database, but clearly from what you've heard earlier, some issues outstanding there. An informed and empowered public. One of the difficulties we have is that however many communications we put out from a place like the college is not necessarily what people are listening to. And we tend all to be in our own echo chambers on social media. Quite difficult to get past that. but we need accessible redress and resolution when things go wrong. And at the English College, we're supporting the Daily Mirror campaign, which wants cosmetic operations to be done by trained surgeons who are on the relevant specialist register. Currently in law, there's nothing to stop a GP undertaking procedures if the patient consents to it. That's a gap. All operations and high-risk procedures must be in safe environments inspected by the CQC. That's the Daily Mirror's other ask, and for it to be a legal requirement for beauty clinics to have some malpractice insurance for the non-surgical interventions to help support patients if things do go wrong.
Thank you. And why do you think regulations regarding who can perform cosmetic surgery are not as stringent as other types of medical intervention? Why is that?
Well, largely because it's practiced in the private sector. So there's a lot of guardrails within the NHS to make sure that high quality standards are applied and maintained, but that's never happened within the private sector. So it's clearly one area which is desperately needing some regulation.
Thank you, Catherine. Natalie.
Thank you. Thank you for everything that you've told us today and all the things that we've learned. Really harrowing, and thank you for the work you're doing around raising awareness. So to Ashton, what steps are being taken to ensure that cosmetic treatments like Botox and dermal fillers are administered by adequately trained and qualified professionals?
From our perspective, we run a PSA accredited register which only permits registered healthcare professionals onto it who are competent to prescribe within aesthetic medicine, and we take all of those individuals through a robust 116-point check. We inspect every clinic listed on our register to make sure that not only the person holding the needle is trained, qualified and insured, but the environments in which they work from are safe and hygienic, and the products that they use are licensed and fit for purpose. And we also, picking up on the informed consent angle, we also take them through a role play scenario where they have to take our assessor through a informed consent, either for dermal fillers or for Botox treatments, so that we can be assured that whenever a patient visits that clinic, that they fully understand exactly what they're embarking upon, so that they can make an informed decision as to whether or not to go ahead.
Yeah, thank you. I've been having a look at your, you've got some clinics near me that I'll absolutely take a look at. What qualifications should practitioners possess to perform non-surgical procedures, and how can we ensure that these qualifications are consistently adhered to across the industry?
It's a very difficult question because the level of training varies greatly because of the lack of regulation. There are recognised qualifications that are available through Ofqual and university outlets, but from our perspective, because we only register healthcare professionals who by virtue of their initial backgrounds have an understanding of anatomy, physiology and pharmacology, they can, select appropriate training courses based on how they feel those things meet their competencies in these areas, but I do think for the general other spectrum of practitioners that offer these treatments, i.e. the non-regulated healthcare professionals, more needs to be done to ensure a standardised approach in terms of qualifications, because at the moment it varies so significantly.
And I think you've already covered this, but it's definitely worth asking because it's so important. Is there adequate oversight and enforcement of regulations for those administering cosmetic treatments?
No, in short, and I think the thing that we've observed over the last 10 years is that, people complain that this sector is unregulated, which in terms of who can and can't do these procedures, that is true today. But there are pieces of legislation and regulation that do exist that should be safeguarding patients having these treatments today that are being grossly under-policed and under-enforced, like, for example, advertising rules, remote prescribing, illegal imports of unlicensed medicines. And like I said, if those things were adequately policed, then we would see a huge transformation of the safety in people having these types of treatments.
And brings me on perfectly to the next question. What are the consequences for practitioners who operate outside of the regulatory framework and administer these unsafe procedures?
At the moment, very little. You know, like Sarah mentioned earlier, you know, if what happened to Sasha and all these other women happened in any other context, these perpetrators would be behind bars, they would be charged with assault and GBH, and actually what these women have been through is technically assault. But out of all of the women that we're supporting, we urge all of them to go to the police and make formal reports. And not one of these cases, outside of Alice Webb, who lost her life, has been taken seriously by police departments. And women are constantly being perceived as silly individuals that are making decisions through vanity, and therefore their complaints are not being taken seriously enough by regulators, and they're being failed.
Wow, thank you. So what changes would you like to see to current regulations and practices in the UK?
I've long called for a task force which would span all of the regulators that currently have a responsibility within this sector, the MHRA, trading standards, the statutory bodies, to meet regularly to make sure that there is accountability within those departments, that complaints are being investigated and followed up and action is being taken, and to preempt emerging trends. Like Vivian mentioned, we would like to see mandatory insurance for all practitioners, because around 80% of the people that we help can't seek any financial compensation because the practitioners are not insured. And we'd also like to see, which is something that we are hugely concerned about at the minute, is the reclassification of certain fat dissolving injections that are being used for cosmetic indications, which are currently only regulated through the general product safety regulations, which means that the manufacturers are not duty bound to prove that their products are effective. They don't have to go through any safety or efficacy trials. And I think it is a crisis waiting to happen, that we'll have an untold number of people coming through with various health issues that are not being captured because of the grey area in these regulations. But I think for us, the most important thing is for Alice's Law to be enacted to make BBLs illegal for anybody to do them other than surgeons in CQC regulated hospitals, because we cannot be in a situation where somebody else loses their life because of one of these procedures.
Thank you.
Thank you, Natalie. On this, is there a risk that we are going to have to constantly keep ahead with the law? Law is slow to change. We've seen that. How do we keep current, and how do we ensure that we are one step ahead of bogus practitioners that will use emerging technologies and tools as part of their arsenal to, say, trick people like Sasha, for example, or anybody into having a procedure that isn't safe?
Yeah, and I think that's a very, very difficult issue that, you know, needs to be addressed, because if you look at the most dangerous of practitioners, they operate like ghosts. And so what tends to happen is they entice people through social media. They have spurious names like Amy's Aesthetics, for example. Amy comes to your house, or you go to a pop-up location. She does the treatment. You may have a mobile phone number if you're lucky. If not, you've just got a social media contact details. And when things go wrong, Amy blocks you. And you've got no fixed address. You don't know her full name, and then how do you go about contacting her? And then when the complaints mount up, she closes that page down and pops up somewhere else. And we've seen this time and time again with perpetrators of these liquid BBLs. You know, we've had individuals where they've caused over 39 people to end up in hospital, yet they're free to carry on with impunity.
Thank you. Professor Lees, what are the primary risks associated with travelling abroad for cosmetic procedures, and is cosmetic tourism having an impact on the NHS, do you think?
Yes, I was going to say that we regularly, on the emergency take, on call, have people in, both from this country and from overseas, who've got acute problems that cannot be sorted out by the people who originally did the treatments. In the case of practitioners here, because they don't have the skill set to sort them, and in the case of overseas tourism, because the patient's too poorly or has otherwise lost confidence in the facility that treated them, so aren't going to go back again, and it will probably be unsafe for them to travel in any case. So I've seen things like a young woman with infected filler injections in the lips, having to have chunks of her lip cut out. You can imagine what that will be like for her over a lifetime. I've seen infected buttock implants coming out, abscesses, collections, bleeding problems in the middle of the night from clinics, actually medical clinics here that don't have the ability to treat their own complications, so that lands up with the NHS, and it's turning into a significant burden of work, particularly for the plastic surgeons, also for the breast surgeons on their service. Clearly that's something that needs to be thought about.
Thank you. Catherine?
Yeah, just a question, I think, for Professor Lees around, we talked earlier about the NHS list. I can't remember exactly what it's called, the kind of register.
Yes.
And you said some improvements are needed on that. And I wondered if you could outline what those are. And then the wider question, if we have time, is just around, do we have enough data on this problem across the whole of the UK, all the different procedures? Are we gathering the data around Sasha's procedure and around other procedures as well? Is there a kind of central register so we can keep an eye on these things?
There's no register for non-surgical procedures. We have FIN data and on the NHS HES data, which captures the private hospital and NHS work. So we are looking at coding for work that's been done overseas that has generated a complication. This will take some time to come in. In terms of the implant registry database, I thought the suggestions made earlier were actually helpful in terms of using that database to perhaps gather more information and to provide practitioners with an annual summary of emerging trends so that they can better counsel and inform the next set of patients that are presenting. That seems sensible.
Sorry, before Catherine comes back, can I just ask, you said it will take some time for this coding to include overseas cosmetic procedures. What's the time frame for some time? Because my definition is very different to, say, my little girl's.
I'd like it done immediately, of course, but my understanding is that the HRG codes are only varied twice a year. So we'd hope to come into the next batch.
Thank you.
That was it, really. Thank you. That was it.
Thank you, everyone. Has anybody... Kirith has got a question.
Final questions. Ashton, you used the word perpetrators earlier. I wanted to ask you all, do you see this as another form of exploitation of women?
Absolutely, and you know, not only are they being exploited and let down by the people that are doing these procedures, actually they are being let down by the system that is designed to protect them at the minute. Like I said, you know, the police aren't taking this seriously. Very few regulators currently take these issues seriously, and I do believe that that is because of the perception that they are related to cosmetic treatments, and therefore it's kind of the women's own fault, which is, you know, it needs to change from the top down.
Yeah. Absolutely.
Yes, I think as well, when something's gone wrong for you and you've approached a practitioner to have something done in good faith, you feel really shy about coming forward. It's not easy to do that.
Yeah, of course it's not.
You know, your account has been very, very moving. It's not easy to complain about some of these things, and we need to understand that as well. 94% of cosmetic operations are received by women, only 6% by men. The global market for cosmetic surgery is going to grow threefold, it's estimated, within the decade. So we're going to see a lot more problems in terms of absolute numbers, and we need to set up a structure that will adequately support legitimate work.
Do you want to... And thank you so much for sharing your story earlier.
Thank you.
I'd like to see it just banned, basically.
Yeah.
Really, really would.
Yeah.
So,
thank you.
Yeah.
Thank you very much. I think we have had an incredibly powerful and informative session. I am so grateful to all of our panellists and you three as well for how fantastic you have been able to articulate the issues, the problems, the solutions. Quite often, sometimes we get panels and witnesses and experts that might give us different ambiguous answers. Yeah. You have been clear at what needs to change, and I am so grateful for that, and I know the rest of the committee is as well. Thank you very much. That brings this session to a close. Order.